Welcome back to the Morning Blend with our continuing series, Insurance 101. Well, due to COVID-19 virus, many healthcare systems are asking patients to avoid in-office visits if possible. Joining us live to make sure that you get the care you need via telemedicine is Luke Stecker. He's with Great Lakes Medicare Solutions. Good morning to you, Luke.
Hey, good morning, Tiffany. It's nice to chat with you.
Absolutely. You as well. You know, I think so many people are concerned right now because going in to see the doctor is highly recommended against unless it's very severe. So what are you guys doing in terms of addressing the concerns for Medicare beneficiaries? What do they need to know?
Absolutely. So we are informing folks to avoid any in-person visits, just about anywhere, but specifically to the doctor's office to help control the spread of the disease. Meanwhile, Medicare or Centers of Medicare and Medicaid Services have been very generous during this time of need and actually lifted the copays and costs associated with COVID-19. They've even eliminated the 3-day inpatient admission typically required to get home health care and about a dozen other waivers. Meanwhile, telemedicine is at the forefront of it all.
Wow. I just think that sounds so like such a relief for so many people who are afraid right now. And, when people are thinking about getting sick, just because you can't see your doctor face to face doesn't mean you should avoid medical attention. Talk a little bit about the role that telemedicine plays.
Absolutely. So you're absolutely right in that understanding. Telemedicine is consulting with a healthcare professional via video or phone. It has become a very important option for millions of older adults, especially in this time of need and the exposure to COVID-19. The federal government actually has temporarily expanded telemedicine services for Medicare beneficiaries to assist in covering the cost associated with that service. I personally have utilized telehealth in the past. I don't know if you have, but I really can't sing its praises enough. I had the opportunity to be presenting in the Pacific Northwest where I became ill and was having difficulty breathing and my energy was pretty low. So I actually utilized my own insurance's teledoc services where I just called into a certain number, told them what was going on, and I was able to have a upper respiratory infection diagnosed and medicine prescribed for treatment within a 20-minute phone call. So I just wanted to share a nice image from the National Council of Aging as it shows how to make the most of your digital time with a doctor or healthcare professional. Some of the things you should do is prepare for the visit, find a quiet space, summarize your condition, and explain concerns to your doctor, and then, of course, agree on a treatment plan. It's truly that easy.
I love that you shared that and your own experience. I was a little bit of a skeptic, but when I tried it, I was like, wow, this is really an incredible service that's offered. And I know that that's something that you focus on is senior risk planning. So how are you currently assisting the Medicare beneficiaries that you work with to work on their Medicare options remotely? What are you doing? Because that, I think, can be confusing for people.
Absolutely. So, it's been business as usual. We always take the educational approach to Medicare, where I'm informing people of what Medicare is, how it provides them coverage, and where it leaves you responsible for out-of-pocket expenses. Lately, however, for safety purposes and, of course, convenience sake, we are now conducting all meetings and the Road to Medicare online via phone call or, jumping on an email. So I strongly encourage you to join us from your phone, computer, or tablet at home. You're able to do this very simply as well, just by going to Facebook and searching Great Lakes Medicare Solutions and registering for an event, or on the website at glmedicaresolutions.com by going to events and selecting a date which works for you. These beneficiaries can also schedule free one-on-one consultations, request free quotes, and even explore plans yourself if you'd like. However, we are currently keeping people informed with their Medicare options and how their plan is providing them relief amid the virus. So continually informing beneficiaries and future beneficiaries that they're still able to apply for Medicare online at ssa.gov, even though local offices are temporarily closed. And for those of you who may have lost a job or health insurance, you can also go to ssa.gov, apply for Medicare remotely, then give us a call to review your options. Employers can actually also utilize the abilities of an independent insurance broker to assist in containing their employees' healthcare cost by alleviating the employees' premiums through Medicare. So whatever the situation is, I encourage you to give us a call and see how we can assist.
Well, and I love that you guys are keeping up with the times, doing things right now virtually. It's okay to have a phone call, and people can attend and re-attend, because if they're not hearing things appropriately, it's okay to continually have that conversation with you, and I know you're open to that. So I want to make sure that everybody has the information for those virtual Road to Medicares, because you're offering them right now on Fridays and Mondays in April. And I've got the dates up right now. So they are free. It is the virtual Medicare training on Fridays in April. It's the 3rd, the 10th, and the 17th, and those are in the morning from 10 to 11 a.m. And then Mondays in April are the 6th, the 13th, and 20th, and Mondays are in the evening from 6 to 7 p.m. The information to contact Luke or Great Lakes Medicare Solutions is 262-358-8734 or glmedicaresolutions.com. And again, Luke can go over everything on the phone. You can look online, you can do email, or attend these virtual seminars. And don't forget about telemedicine, a great option that you're providing so many of those you work for with. Thank you so much for joining us, Luke.
Yeah, thank you so much, Tiffany. I really do look forward to helping the community have easier access to their healthcare options on Medicare. And again, just like you, we're fully committed to this community, and we're just asking that everybody stay safe, check on your loved ones and neighbors, and of course, give us a call for any of your insurance solutions.
Absolutely. You stay healthy. Thanks so much, Luke. That was super cute.
All right, thanks, Tiffany.
Yeah, you bet.